All right, staying with the health theme, every day at least one person goes to the Idaho Falls Community Hospital with stroke-like symptoms. A hospital representative shares that 1 in 4 people will either be affected by a stroke or know someone affected by one. Local News 8's Braden Wilson joins me now here in the studio to tell us more about the hospital's program for stroke survivors. Braden.
Thanks, Dylan. The Idaho Falls Community Hospital has started a brand new support group. The group is designed to help caretakers, survivors, and family members of stroke survivors. It provides both education and community resources. The topic is also very personal to some group sponsors. Gordon Dixon is a doctor at Mountain View Hospital. He is also a stroke survivor. Dr. Dixon struggles with aphasia as a result of the stroke. Aphasia is the difficulty with language and can present as struggling to speak or even understand speech. Dr. Dixon says he spent a few years going to speech therapy so he can still communicate with others, as well as physical therapy to regain the use of his arms and legs affected by his stroke. He says a support group like this one will be a big help as he continues to thrive after his stroke.
For me, to help the other patients for usually for aphasia, other patients aphasia.
He shares his story at group meetings to encourage others to keep going. Dr. Dixon highly recommends anyone who's had a stroke attend the meetings, especially those who struggle with aphasia. Now, Dylan, Dr. Dixon and his colleagues shared how the earlier you can get treatment, the better. They shared some of the early warning signs of a stroke. Those warning signs can be found through the acronym B FAST. B stands for the loss of balance or people feeling dizzy. E stands for any vision changes such as blurred and double vision. F stands for the face and facial drops. A stands for any arm or leg weaknesses, which happen to usually be on one side. S stands for speech, especially if it becomes slurred or people starting to struggle to communicate. T stands for time is of the essence. And Dylan, the doctors and nurses I talked with said if you can get in the hospital within the first 4 hours of stroke symptoms, the higher the chance you'll get the appropriate treatment in a quick time frame. Dylan, back over to you.
All right, thank you, Braden. Great information. And if you're interested in visiting with the Stroke Support Group, it meets the second Tuesday of the month at the Idaho Falls Community Hospital from 5 to 6.